Hey, welcome to The Explainer. So today, we're going to tackle a really critical medical condition known as asphyxia. And we're going to use this incredible set of detailed, handwritten clinical notes as our guide to really understand it from the inside out.
So here's the plan. First, we'll get a handle on what we're actually talking about. What is asphyxia? Then we'll dig into the causes and the all-important warning signs. And from there, we'll shift to solutions, from what you can do right away to how it's handled long-term.
Think about this for a second. What really happens when the body's most vital supply line gets cut? I'm talking about oxygen, the fuel for every single cell in our body. When that flow is interrupted, it's a crisis. And to understand it, we've got a really unique guide.
And this is it. This is our roadmap for today. We're going straight to the source with these amazing clinical notes, which gives us a direct window into how medical professionals think about and approach this condition.
All right, first things first, let's get down to the basics. What exactly is asphyxia when we strip it all down?
So it's actually not just one problem, it's two happening at the same time. It's a real one-two punch. You've got hypoxia, which means not enough oxygen is getting to your tissues. And at the same time, you have hypercapnia, which is a dangerous buildup of carbon dioxide. So it's a dual-front crisis for the body. Now this number, this is the one that should really stick with you. 4 to 6 minutes. That is the terrifyingly short window before a lack of oxygen can cause permanent, irreversible brain injury. Time is everything here. Every second counts.
So how does this even happen? Well, the causes can pretty much be boiled down to 4 main categories.
And these notes show us something really smart that clinicians do. They group the causes into these 4 buckets. In a chaotic, high-pressure situation, having these mental categories makes diagnosis so much faster and simpler.
I mean, just look at this table. The range of causes is incredible, right? It could be something physical, like choking on food. It could be the environment you're in, like a confined space with no fresh air. It can even be your own body with a medical issue, like a severe asthma attack. Or it could be an invisible poison, like carbon monoxide. The triggers are just so varied.
Okay, this is so important. Knowing the warning signs is absolutely key for getting help fast, and they often show up in a pretty clear sequence, getting worse and worse over time.
So at first, the body is basically screaming for help. It's panicking. It's trying to get more oxygen in any way it can. That's why you see things like rapid breathing, a racing heart, and this feeling of anxiety. And that bluish tint to the skin, called cyanosis, that's a huge visual red flag that oxygen levels are dropping fast.
But what happens if that oxygen doesn't come? Well, that's when things get really serious. The body's systems start to fail, they start to shut down. The brain gets hit first, which leads to confusion. Breathing becomes erratic and might even stop altogether. This is the stage where the situation can turn catastrophic, leading to seizures, loss of consciousness, and even cardiac arrest. And if help doesn't arrive in time, the end result is, well, it's devastating. The lack of oxygen causes widespread damage, which can lead to permanent brain injury, the failure of multiple organs, and ultimately, death.
Okay, so this brings us to what might be the most important part of this whole explainer. What do you actually do? How do you spot this? And what actions can literally save a life?
So when the pros get there, they move fast. The diagnosis is what we call clinical, which really just means they're looking at the person, their physical signs, and the situation they were in. They'll use quick tools like a pulse oximeter that clips on a finger to check oxygen levels, and then maybe more detailed tests like an arterial blood gas to get a super precise measurement. Now, for anyone who's the first on the scene, this is your playbook. Follow these steps in this order. First, and I can't stress this enough, make sure you are safe. Then get the person away from whatever is causing the problem, whether it's smoke, water, or something else. Call for help immediately. Then and only then you can focus on the patient. Open and clear their airway, and if you know how, perform the Heimlich or start CPR if they're unresponsive.
All right, so once the patient gets to the hospital, the game changes. The level of care really ramps up and it gets a lot more advanced.
In the hospital, it's all about one thing: getting oxygen flowing again. That's job number 1. The medical team will secure the airway, maybe even with a breathing tube. They'll provide high-flow oxygen or use a ventilator to breathe for the patient. They'll support the heart and circulation. And all the while, they're trying to fix whatever caused the problem in the first place.
So we've talked a lot about what to do when things go wrong, but what about preventing them from going wrong in the first place? That's the best medicine, right?
And what's so great about this section of the notes is how simple and practical these tips are. This isn't some complex medical stuff that only doctors can do. It's stuff that we can all be aware of in our daily lives.
I mean, look at this list. It all comes down to awareness and being prepared. Things like knowing choking first aid, having smoke detectors that work, managing conditions like asthma properly, and keeping a close eye on kids. These simple things save lives. It's as simple as that.
And really, that's what this all boils down to. Asphyxia is fast, and it's scary, no doubt about it. But knowledge is power. Understanding the causes, recognizing the signs, and knowing those first few steps to take, that's your superpower. It can literally turn a potential tragedy into a life saved. So the real question is, are you prepared to act?